Are you getting migraines more often? Could be a change in the weather. Migraines are a huge problem. Migraines cost $31 billion annually in lost productivity. 70% of the people who get migraines are women. So do injections help? What does help? We're going to talk about it, get you some answers coming up on the Morning Medical Update. Good Friday morning. It's June 17th. I'm Alexis Delcid in for Jessica Lovell. Thanks for joining us here on Facebook, YouTube, and on Twitter. A popular music star announces half of his face is paralyzed. What's behind that, and what do you need to know if this happens to you? Also, Dr. Dana Hawkinson joins us with the latest COVID-19 numbers here at the health system. Now to migraines. All right, honey, I have a headache. It's not just an expression. Migraines are a horrible problem. So we're going to talk about the best and the newest ways to treat migraines and how do we prevent them. Start sending in all your questions now. Headaches and migraines are a hot topic. We would love for you to be part of this conversation because your questions are what always drive our conversations here. Send them now to Facebook, Twitter, and the Medical News Network. You can find those links right there on your screen. But first, your headlines. And we want to start with something that so many people are talking about. And many of us, quite frankly, had never heard of this until a couple of weeks ago. Ramsay Hunt syndrome. Pop star Justin Bieber says it's the virus that has paralyzed half of his face. He revealed it to his fans on social media after having to cancel some of his upcoming concerts.
As you can see, this eye is not blinking. I can't smile on this side of my face. This nostril will not move.
Poor guy. In his video, he talked about it being a real wake-up call, saying he really needs to start slowing down and getting some rest. Doctors say Ramsay Hunt syndrome is caused by the varicella zoster virus. That's the virus that causes chickenpox. You might not have heard of that virus. Everyone's heard of chickenpox. So if Bieber can get it, and he's a really young guy, what about the rest of us? Justin Bieber's 28. Joining us this morning to talk about this is Dr. Arpan Patel, a neurologist here at the health system. Good morning, Dr. Patel. First question, how common is Ramsay Hunt syndrome? Because a lot of us had never heard of this. And is there an age where this can typically hit you?
First, I will clarify difference between Ramsay Hunt syndrome and zoster infection. So zoster infection can happen anywhere in our body, but when it happens in the area supplied by facial nerve, like our face or ears or eyes, then it's called Ramsay Hunt syndrome. And based on CDC data, every year, 1 in 20,000 people develop Ramsay Hunt syndrome. And when we look these statistics over lifetime, then this risk will increase from 1 in 20,000 in 1 year to 1 in every 250 people.
And 1 in every 250 people are expected to get this?
Over the lifetime.
Okay. So,
yeah.
Doctor, what triggers this? I mean, is this similar to, is it like Bell's palsy where the virus is laying dormant or shingles?
So whenever someone has chickenpox infection during their childhood, this virus will stay as inactive virus in our body. And whenever there is a enormous stress or decrease in our immunity through infection, or if we are taking any treatment drugs, which can decrease our immunity, or if we have any cancer, which can decrease our immunity, then this virus gets activated. Usually this affects those who are more than age of 50, and incidence of this infection will increase as we age even more. But younger patients, sometimes when they have stress or immunity change, then they are also have this infection. Another point I want to make is COVID-19. So there are published case series and case report about people developing Ramsay Hunt syndrome after COVID-19 infection or COVID-19 vaccine. But I would say that there is no strong data and we should not refrain anyone from getting COVID-19 vaccine.
So how do you treat it when or if you get it? What's Justin Bieber going to be doing over the next few weeks? And what would someone sitting at home who gets Ramsay Hunt syndrome do?
Yeah, so for our treatment goal for Ramsay Hunt syndrome, we have two goals: to prevent disabilities like facial weakness, hearing loss, and to treat symptomatically for dry eye. So to prevent complication, we usually do oral steroid and antivirals like acyclovir or valacyclovir. And we have a strong data that if we start treatment within first 72 hours of infection, then we have a really good success with the recovery. And second recovery point is also if patient is young, then they have higher recovery and almost full recovery compared to someone who is old.
So one more quick question. You talked about how if anyone who's had chickenpox as a child is carrying this virus, is dormant. So what about the whole generation that never got chickenpox because they've been vaccinated against it? Then will they never have a chance of getting Ramsay Hunt syndrome?
That's a really good question. Now, we know that even if we have vaccination, but we have decrease in our immunity, like when we age or through any other cause. So even during that time, we are at risk of getting Ramsay Hunt syndrome. Now, we have two ways how we can prevent this. First is vaccination. So if we give vaccination to kids over their recommended time period, then they have less chances of developing Ramsay Hunt syndrome. And also, this vaccination is also recommended to older people over age of 50. And usually between like young adults like Justin. So when they never had chickenpox infection during their childhood and they never received vaccine, it is recommended that they should also get 2 doses of vaccine.
Okay. Dr. Patel, thank you for taking time to join us today and talk about this, because so many people have been speculating and Googling Ramsay Hunt syndrome. So now we have a pro who could actually give us the answers. Thank you.
Thank you so much, Alexis.
Speaking of issues with your head, we know Justin Bieber's dealing with a lot of those with his face being half of it paralyzed. We're also talking about headaches this morning. And did you know headaches are among the most common disorders of the nervous system? It's estimated that almost half of all the adults in the U.S. has had a headache at least once within the past year, and more than 3 million of us live with chronic migraines. Also, according to the National Institutes of Health, migraines can last anywhere from 4 hours to 3 days. Joining us this morning to talk about migraines and headaches is Dr. Deetra Ford. Doctor, thank you so much for being here. Imagine having a migraine for 3 days. We all know someone who has those chronic migraines. June is Migraine and Headache Awareness Month. Why are most of the migraine sufferers women? 70%?
That's a really great question. So we assume it's due to hormones to a degree, but there's also some interesting data out there on CGRP, which is kind of the new buzzword out in our migraine community. And there have been some studies on rodents, actually, which is always what we do first. And it seems to be that CGRP seems more sensitive in females versus males in triggering the migraines. So that'll be interesting research down the road to see what happens with that.
Also, you're a neurologist as well, so I should have said that off the top. So you deal with this all the time, Dr. Ford. What are the most common triggers? Because I feel like caffeine always helps my head when it starts to hurt. Is that a trigger? I've heard conflicting things because it helps some people.
Absolutely. So my take on caffeine is that you be consistent. So if you have 2 cups of coffee every day, you can stick with your 2 cups every day.
Okay.
I think quantity matters. So if you drink a lot of caffeine, I think that's probably going to be a trigger. Also, caffeine withdrawal. If you drink a lot one day and then don't drink any the next. What we do find is doing the extra espresso shots in your Starbucks drink does seem to be a little bit more of a trigger for folks. So it's basically about consistency.
Would there be any other triggers of foods or drinks that we consume that tend to cause migraines?
So alcohol is a big one. Other foods would be cheeses, dairy products, weird things like overripe avocados and bananas, onions, beans.
Wait. Overripe avocados and bananas can cause migraines?
Overripe fruit seems to be a big trigger for people as well.
Weird.
And so it's unclear exactly what it is, but it's likely the breakdown products that come with that as the fruit ripens too far.
So there goes the banana bread, the glass of wine.
Not necessarily gone, but just in moderation, knowing your triggers.
So there has been some clinical trials recently on something called osteopathy to treat headaches and migraines.
Yes.
What is osteopathy? Is your beeper going off?
Oh, Yep,
Our
sorry.
doctors are very important. They have, no, don't be sorry. You got to keep your beepers on. So do you have to take that?
No,
Are you
I'm
good?
good. We're good.
Okay. All right. We don't want to get in the way of your patient
No, you're
care.
fine.
So there were clinical trials in something called osteopathy to treat headaches and migraines. So what is osteopathy and how has it been found to help?
Absolutely. So osteopathy is manipulation. So you think of doctors of osteopathy, so our DOs even here at the
Right.
health system. And they're actually trained in specific manipulations to actually help with chronic pain, headaches.
What do you mean by manipulations?
Sure. So people know a lot about chiropractors. So I kind of
Right.
equate it to that, only a safe version. So they learn a little bit more about the musculoskeletal system, gives a little bit more preference to safety, if you will. They don't do high frequency manipulation of the neck, which has a risk for dissection. So they do more craniosacral therapies, muscular therapies, things like that for adjustments. And that's going to help you more with your tension and cervicogenic headaches.
So they'll do gentle manipulations of the head
Yes.
and the neck. Are there any other trigger points in the body that have been found to be connected to migraines?
Yes, so mainly they're all going to be up here in the head and neck area.
Okay.
The upper shoulders are also a big area that we see a lot of adjustments to, but it also is shown that if you have pain in the lower back or thoracic spine, so that middle and lower area, those can actually trigger headaches as well.
What about IV lidocaine? We've all heard of the lidocaine that's topical,
Absolutely.
but is it what it sounds like? You're injecting lidocaine?
It absolutely is. So currently we use IV lidocaine very rarely.
Okay.
Lidocaine is usually going to be used topical for sphenopalatine ganglion blocks. It's going to be used for occipital nerve blocks, things that are more external. IV lidocaine and IV ketamine, so those are kind of the new kids on the block, if you will. They've been used for a long time, but the research is becoming more and more that we should look at those for inpatient treatments. Those are not something you would do outpatient in a clinic. This is something that requires monitoring, usually cardiac monitoring. There are risks of arrhythmias. So we definitely want to have people in the hospital for those. And those are going to be your really refractory migraine cases, people who have been days and days in a cycle where none of
Right.
our typical things are working.
Where the person who's suffering on their third day of this horrific migraine.
Or more, yes, because the studies are conflicting on the data so far. So there have been a few, one recently in a pain journal that showed some benefit, but it's out at 30 days. We're not sure that it makes as much of a benefit as it does acutely, so people end up back in that cycle, and a proportion of those patients even end up readmitted.
A few years ago, when I was a news anchor in Kansas City, did a story on a woman named Lori who had suffered horrible migraines, and she was getting regular Botox up at certain parts of her head to help with that. Have you found that helps on your patients as well?
Yes, absolutely. That's one of our mainstays of treatment, actually, for our
Botox.
chronic migraine patients. Yes, it's a little daunting because it's 31 injections. It takes about 8 to 10 minutes, so it's not a very time-consuming process, but
Right.
it is a little uncomfortable. People do have great results with it, though, so we combine it with a lot of our therapies now.
Are you putting the Botox in the same places that women get it to get rid of the 11s?
Yes.
And the you know what I'm talking about?
Absolutely.
So is that the same thing? So
So it's the same Botox. It's cosmetic,
in the same
technically.
places of the
Very similar, and
Yeah.
they're obviously we don't tote it as cosmetic Botox. It is medical
Yeah.
Botox, but it is very similar places. You're going to get very similar results with it with a good trained injector.
that's a twofer.
It is
right there.
It absolutely is.
What about non-drug ways? As far as you talk about things in our diet that might trigger it, are there any non-pharmaceutical ways that could help ease migraines?
Yeah, absolutely. So we have a lot of over-the-counter things that we know work. So magnesium oxide, CoQ10 is another one for the antioxidant component, riboflavin, which is a B2 vitamin. So all of those are very helpful. There's a lot of other studies going on other antioxidants.
Are those supplements?
Yes, sorry.
So you
yes,
could go
all
on Amazon
supplements.
and
You can go on Amazon. They're very inexpensive. Side effects are minimal with those. We also have other things that are really coming out more and more now with our pain technology, is more doing pain psychology, cognitive behavioral therapy, meditation. There are lots of apps and ways to help with that. We also have a couple pain psychologists here at KU that we utilize quite frequently for that as well.
What about light from all of our screens? I know Jess Lovell wears glasses that block blue light.
Yes.
Does that also help with migraines?
It does. It does.
Yeah.
So most of our screens, if everyone knows on their computer, you can actually have a setting where you can go in and pick the blue light setting. And then they also make really inexpensive screen protectors on Amazon. You can even order them there that you can put over the top of your screen that will even give more protection. And then they have blue light blocking glasses as well that can even
Right.
be non-prescription.
Dr. Ford, we're going to keep you around the whole
Okay.
show because my phone has been lighting up with questions from our viewers. So we're going to keep you for the viewer questions and to continue this topic, because coming up, we're also going to talk about the American Headache Society's annual conference. It just wrapped up. We're going to break down the biggest developments coming out of that conference that could also help you. We do want to go to our viewer questions right now, our community questions. We have one from Jessica. Jessica wants to know, are injections the only option for these newer meds? Because a lot of people don't like needles.
Yes. So the newer meds that we're probably referring to are going to be the CGRP injectables, so Ajovy, Amavig, those things that we've heard about a lot in the news. And there is one IV infusion option for people who don't want to do an injection at home, which is nice. But the newest things on the block are going to be our or GPANs are what they're called. So they're basically a small molecule CGRP. And they have pills for those now. So we have a couple of them are out. Some are every other day dosing, some are daily dosing. And kind of we'll talk about newer things coming too, but there may be some other options out there very soon. But those are the newest things that have been out this year.
I want to bring in Dr. Dana Hawkinson, who is our Medical Director of Infection Prevention and Control, because Dr. Hawkinson, I'm also getting some questions about COVID here. You have our latest numbers this morning, and Dr. Hawkinson is continuing another day of reporting to us from Utah on his vacation. Do you ever take a day off, or are you just like Superman?
I have some days off, but not too many.
But rare. Only when he's changing in the photo
Rare.
booth into his doctor's outfit.
It's
Okay,
all-
tell us the latest numbers.
It's all to help the public out there and get them informed, keep them informed.
That's why we love
Right now
you.
we have 18. Right now we have 18 active infections, 3 in the ICU, 1 on the ventilator, and 6 in that recovery period. So our numbers have gone up. Spoke with everybody knows Amanda Cackler and Lance Williamson, looking at our acute cases, our active cases, and it seems that as most of those people are in for COVID. So although we haven't seen a large trend in the increasing recorded cases, obviously we know people aren't always going to get the PCR test, but maybe doing it at home. We have seen a significant increase in the number of people hospitalized for it here at the health system. But overall, those numbers continue to be much, much lower than they were in the most recent surge. So,
one of the big developments that a lot of parents are excited about is the FDA panel endorsing the vaccine for children 6 months to 5 years old. There are all these toddlers who've lived their entire life in a pandemic, never vaccinated. So how soon before the shots begin, and what do parents watching need to know?
I thought we were maybe looking at late June, early July for availability of the vaccine for children. I think this is really great. We have heard that data as well, that many, many children in the United States, a large percent, maybe even up to 75%, have actually had COVID or had exposure. So I think this is one more thing to help protect your child. We also understand the basic science that if you've had basically 3 exposures to spike protein, you are very well protected, and there is durable protection there. So if your child has been infected with SARS-CoV-2, it's extremely important to go get those 2 or 3 vaccine doses to help boost and maintain that immune response as well. So I think that's very good. We know that overall the risk of severe disease and complications in children is much lower. But if that is your child, you want to do everything you can do to reduce the risk of any complications. So these new vaccines, we know vaccination is the safest way to immunity. And doing this and having those vaccines available is just overall going to be a good thing.
In Sweden, researchers have identified a new strain of the coronavirus. This is currently infecting rodents, Swedish bank voles. I'm going to have to Google what Swedish bank voles look like after this. What is this new virus, and should people be concerned?
I don't think there's any reason to be concerned. Again, I think it is it gets a lot of clicks probably, and a lot of people reading it. We do understand that these are not new. Last year alone, there were at least 2 published reports of canine or dog coronaviruses spilling over into humans. We know that in the past, pig coronaviruses have spilled into humans. It doesn't seem that those do take on more infection or spread from human to human. It is definitely something we need to watch for. We know that during the early parts of the pandemic, a lot of funding was cut for research, for surveillance of these types of infections. We need more resources put out towards that for sure. to look at all of these other species and all the viruses that they may harbor that we could have spillovers into human. We know that as climate change is increasing, animals are moving from one region to another. We know that as humans, we are going more into nature, whether for development of areas to live or just for activities. We know that we will have more contact with animals, so these spillover events could happen. But this is nothing new. This is well documented in the research with other coronaviruses and other species as well.
Another story in the news, Dr. Fauci testing positive for COVID-19. There was a time a year or two ago where everyone would have been stunned and rattled and frightened by that news. But are we at a point now where everyone we know pretty much is going to get it one way or another?
I think so. If they haven't already, I know I have there was an early betting pool going on with a group of people around Kansas City with people who I work with and colleagues and healthcare workers to see who could get it last. Certainly, I understood that with my risks of having two teenage kids, I would probably be at higher risk because of exposure. But we know there is still a large group of people who haven't had it. This is not surprising. Overall, it's going to be okay for Dr. Fauci. He is primed with his 2 vaccine doses and then the 2 boosters. And of course, I would assume he's probably getting Paxlovid as well. But we have to assume that as time goes on and people are out doing things and interacting with other people, and there are no really public health restrictions in place, more and more people will become infected. But we do have the saving grace of prevention with vaccination and also treatment now.
Speaking of people, finally, Kansas City is getting the World Cup. Huge news yesterday. This was so fun to hear and see. We were selected as a host site for 2026. So Dr. Hawkinson, my question for you is, what does this mean for the community, the medical community specifically, preparing for this influx of tens of thousands of people coming into Kansas City? I'm talking, yes, tracking viruses and the pandemic, if we're still dealing with coronavirus and COVID by then, but also just medically speaking, all those people in our city. How does the health system prepare for this?
I think the health system is well prepared for this. They have great experience working at Arrowhead. We know that the health system has put people out at the racetrack. We have very good experience working on those acute sites, those places where there's going to be a large influx of people. As we move forward, we know our emergency management and our teams that go out to those places, such as Arrowhead, are going to prepare even more and have everything ready. Obviously, it will be in the summer, so heat will be a factor. But we have 4 years to prepare. And I know with the track record that we have at those places, at those venues, as a health system, putting our great people there, our emergency room physicians, our primary care physicians, our emergency room nurses and respiratory therapists. I'm sure that the people who come to Kansas City overall are going to be in good hands healthcare-wise, but also especially at that particular venue.
You're tamping down your enthusiasm, Hawk. We know you're a huge soccer fan. Tell us straight. Did you scream? Did you scream and jump in the air when you saw that news?
I was texting with one of our other colleagues, Dr. Chris Brown, one of our hospitalists, who's a huge soccer fan. So we were texting back and forth. We have to get ready to save the money for tickets now because we know tickets are extremely expensive and probably only going to go up. So I would advise anybody who's wanting to go start saving right now for those tickets. But I think we have to cross our fingers and hope we get, whatever games we get, it's going to be great. The talent, the footballing or soccer talent is going to be excellent. So if everybody can try to get to that venue as much as possible and see that those world-class footballers or world-class soccer players, it'll be a great experience.
It's going to be so much fun. Thanks, Dr. Hawkinson. Now back to our hot topic today. We're talking about migraines, and joining us this morning to talk about migraines and headaches is Dr. Deetra Ford, a neurologist here at the University of Kansas Health System. Thank you so much for being here.
Absolutely.
Again, 70% of migraine sufferers are women, so we're talking about that as well. And the American Headache Society just wrapped up its annual conference in Denver, and a big topic was why headaches and migraines, in addition to women, 70%, have been happening in children and teenagers so much more during the pandemic. The number of kids getting migraines has gone up. Why?
Yeah. So, there are lots of speculations there, but obviously stress is huge. So underlying anxiety and stress has been with all of us throughout this pandemic, but I think our children have been affected much more than we even know. School's been different, masking, not being able to go out and do sports and activities with our friends. So I think it's really disrupted sleep patterns, it's disrupted our eating habits, it's disrupted our schedules. And so we really believe that's probably a big portion of it. Obviously, COVID does contribute to some headaches as well, but I think the true part of it is really just the stress that it's put on all of us. And it's been low-lying for some and much stronger for others, but none of us are free from that.
Coming out of this conference, have you heard of new breakthrough technology and treatments that are showing some real hope for people who have been suffering with these debilitating migraines?
Yes, so what we're hopeful is that the CGRP pathway, which has been the hot topic for the last 2 or 3 years now, is going to continue to grow. There are lots of medications that are being developed in that realm. And some, again, we talked about earlier, injections not being something that everyone wants to do. And luckily, they're coming up with some intranasal options, so it'll be inhaled just like some of your normal inhalers would be. There are other pills and other injections, infusions coming out. They're also looking at other receptors that are possible targets, and so we're really trying to look at a lot of options there. The other thing that's been really big is as neuromodulating devices. So there's even a brand new one, Relivion, which is going to be something that'll stimulate the frontal nerves and the occipital nerves at the same time, which is kind of a take on the Cephally device, only more. Nerivio is an armband. We have, again, quite a few options.
An armband?
Yes.
How does that work?
Absolutely. So it's a great question how it works. So it's supposed to work on what we call the nociceptive pain receptor. There's a certain fiber there. But you wear the armband, and when you have the migraine, you're able to turn that armband on, and it provides some stimulation there. And the hope is that that's going to break that headache cycle at that point.
I'm getting so many questions from the community, so I want to get to those real quick. One more question from us.
Of course.
Can you talk about what a sleep apnea headache is?
Absolutely. So it does, again, go a little bit with the pandemic. So there's obviously been change in our lifestyles, decrease in exercise, weight gain, which all can lead to sleep apnea concerns. And so typically a sleep apnea headache, what we would consider that and start asking questions about is a headache that wakes you up in the morning or you wake up with in the morning. So anywhere from 4 to 9 a.m. really is pretty average on that. It's going to be something that is pretty holocephalic. So the whole head will kind of hurt, or really in the frontal or back area, kind of very dull, achy type of headache, not typically your migrainous type headache necessarily, but it can trigger migraines in some patients. So if you're developing a headache every morning when you wake up, it's something you really want to talk to your doctors about, because the sleep study is very, very easy to do. People are really scared of them. They have home sleep studies now. It's very, very easy to get diagnosed. The newer treatments for sleep apnea are wonderful. So it's not just a CPAP anymore. We do have the Inspire device. You can use wedges, oral appliances, weight loss, exercise. So I really encourage people to go out and get checked out for that.
Before we get to community questions, do we have any reporter questions today? Any reporters on the line? We're good. Okay, I want to also weave Dr. Patel back into this discussion. You heard from him at the beginning when he talked about Justin Bieber and Ramsay Hunt syndrome. Our first question from viewer Isaac, and Dr. Patel, I'll ask you this. Isaac writes, I know there's a recent episode on strokes. How do people know if their migraine is not a stroke?
That's a really good question. When someone has a migraine, they can have a migraine aura, and migraine aura can cause transient symptoms, which can include numbness over your face, arms, and legs, or it can cause weakness on one side of the body, or it can cause visual loss. To differentiate these from TIA or stroke is the timeline. When TIA and stroke happens, you will get deficits like numbness or vision loss or weakness over like 1 second or 2 seconds. But when you have weakness or sensory problems like numbness from migraine, it usually takes several minutes to develop. And usually they go over after 20 to 1 hour and you have a headache. So if you have previous history of migraine, then likelihood this from migraine aura is higher.
Kathy has a question for Dr. Ford.
Sure.
Kathy writes, I don't have migraines. I didn't usually have migraines until the last decade, and it's more like pressure on my face, or it feels like the squeezing of my head when we have big swings in the weather fronts. Is that the sinuses? Is that the cause?
So it's a tough question. So I would say definitely reach out to your actual physician and have them look at things, because it depends on if there are other factors. So if you're having a lot of sinus drainage, if you're having trouble with your ears popping, those definitely can be sinus factors there as well. Allergies have been really rough this year, so that can contribute to a facial pressure as well. For the fact of weather, absolutely weather plays a role in headaches. We have had lots of debate over that for the years, but there's a more recent study out of Japan where they actually looked at what the actual barometric pressure would be that would cause some intravascular changes that might lead to migraines. And so we do believe that it is related for sure.
Brian Lunt has a question. Actually, Brian, this has happened to me before. Viewer Brian writes, what causes the flashing light aura? I eventually go blind in one eye and need to sleep it off for 24 hours. Will these types of migraines ever stop? Could this be a serious issue that lasts a lifetime? There's a bunch of questions there. Dr. Patel, I'll ask you the first one. Is there a name for that kind of migraine where you see the flashing lights?
Yeah, so it's called scintillating scotoma. It's a visual aura of the migraine.
And is this something, Dr. Ford, that's going to be a serious issue later on in life, or is this as bad as it gets?
So that's a tricky question as well. So we do know that migraine with aura does predispose just slightly above normal population for risk for stroke. And so it is something that you want to be evaluated for with your doctor. It could be your primary care doctor. They're very well versed in this. It has more implications for women in terms of birth control options than men alone, but definitely something you want to have evaluated. Not uncommon, unfortunately, but we do hope that it will go away over your lifetime. Typically, we start to see some decline in those in our 50s and 60s, but not definite. Unfortunately, you can also develop new auras later in the 7th and 8th decade of life as well. So it's hard to tell you for sure, but I would definitely recommend getting treatment for it.
Kathy has a question to piggyback on that. She started experiencing ocular migraines. There's no pain, but she says, I see this zigzag backward C that lasts 15 to 20 minutes. Have you ever heard of that?
Absolutely. So that's something we deal with a lot in our neurology clinic because people get sent to us for concerns for stroke or some sort of retinal problem. And so we work really closely with our ophthalmologist to try to tease out what exactly is going on and make sure there isn't another issue problem happening. But definitely, we used to call them acephalgic migraine, which means without pain. And so now we term them more related to what the symptoms are that we're seeing. So that's where ocular migraine came from. But that's actually common, and again, something that is treatable.
Melissa would like to know, Dr. Patel, what is CGRP? Did we mention that in our conversation?
We did.
Okay, CGRP. Yeah. There's a lot of medical lingo flying around. So what is CGRP?
So CGRP is a molecule in our brain, and all of us have. But those patients who have migraine, they have sensitization to CGRP, and they are likely to get more headache from CGRP. Newer medication, as Dr. Ford mentioned, like Aimovig, Emgality, those injections and also tablets like Uberville, they are designed to block this CGRP molecule to prevent headache.
Emily has a question. Dr. Ford. Emily writes, my mother has been told she has atypical migraines. What are atypical migraines, and does this mean I'll be more likely to have those kinds of migraines? Because it seems like our whole family deals with ear and sinus infections. Is this all related?
Great. So ear and sinus infections, probably not. They probably are actually separate, but those can all trigger migraines. Atypical migraine, it would really depend on what symptoms she's having at that time. So a classic typical migraine would be a unilateral, meaning one-sided headache that is throbbing or pulsating. So you almost feel your heartbeat in your head. That's pretty moderate to severe intensity. It can be associated with nausea, vomiting, or light and sound sensitivity, or all of those things, and usually takes us out of our ability to do our daily activities during the time that it's affecting us. Atypical migraines may have some of those features, may include other parts of the head. There are lots of things that can be a part of that classification. But in terms of family risks, absolutely, we think that migraines do have a genetic component. They're looking at a lot of different genes for that. We know that hemiplegic migraine, for example, which is a really rare type of migraine, is definitely familial, and there are genes that we have identified for that already. So I think that this is a work in progress, but we're pretty certain they do have a link.
So would you say, just sitting here and listening to you and Dr. Patel talk about all these different kinds of migraines and headaches, if someone sitting at home is watching this and they do have bad migraines, they don't know what kind of migraine they're getting, do they go to their GP and ask to see a neurologist, or do they try to get into a neurologist? Like, could they make an appointment right away with a neurologist?
Yeah, so honestly, I would recommend talking to your primary care physician first, because they are actually really well versed in headache conditions and migraine. It's kind of their first step is to figure out what they think the headache type is, and even trial a medication or two. We're often going to get the more complex patients that have other medical problems that cause problems with the medications that they might be able to use. But you can always definitely contact a neurologist if that's your preference, but definitely seeing a primary care physician first is the right way to go.
Dr. Patel would like to, Melissa would like to know of Dr. Patel, what foods should she eat to avoid migraines?
That's a good question. Now, regarding the food, I would say first, many patients, they get migraine when they skip their meal. So make sure you are eating your meal on regular intervals and you don't have any periods where you stay hungry. Second, some food like ginger, or as Dr. Ford previously mentioned, like make sure you are taking your coffee on time. So ginger also helps with migraine. And as Dr. Ford mentioned, we have to avoid some ripened food like banana, avocado.
So avoid raw, like real mushy bananas. Okay, and I wonder if cooking the bananas takes away the risk, because I love banana bread.
I don't know. I have no idea. It would be a true test. You could do it. You could make that
I could
work.
test it. I don't know if I want to be the tester of that. Okay, Joellen wants to know, she said, I used to get headaches all the time because of stress years ago. Now not so much. So can you get over headaches as a response to your stress?
Yes, so reducing stress definitely can help with that. And that's where that cognitive behavioral therapy that we talked about earlier with the pain psychologist, meditation, exercise, those things really do help. And so absolutely you can reduce your migraines with reduction of stress. And we've seen that through the pandemic with some people being able to work from home. They have felt that that has helped them. So it's variable for each person, but definitely can happen.
Fanny has another question for you because we talked about Botox.
Yes.
Can you speak about Botox for apraxia post-stroke for contractures? I don't know what any of that means.
Sure. So apraxia is basically not being able to use a limb the way it's intended to use. So
Post-stroke, okay.
Yes, post-stroke. So it's not necessarily going to help that particular component, but Botox will help with spasticity. So we inject it into the muscles to try to relax those muscles so they're not so tight, which causes pain and discomfort, and sometimes hinders people from being able to use the limb more.
What are contractures?
Great question. So basically, it's a tightening of the muscles. So, for example, just to kind of show, people might get a claw in their hand. It might happen in the leg. It might make it hard for them to walk where their leg stays stiff and they have to move that leg forward each time they want to make a step because it's not bending the appropriate way.
But as far as Botox goes for treating those, for Fanny's question.
Yes, it works great for those. So we have to be careful with the doses we use. Some people require that tone from that spasticity in their legs to walk. So we have to start low and slow for that. But absolutely works for reducing pain and relaxing those muscles.
It's amazing how Botox is just wonderful for so many things. Jean wants to know, this is for Dr. Hawkinson. Dr. Hawkinson, question from Jean. What are your recommendations when it comes to quality masking, given the recent increase in COVID cases in Johnson County? By quality masking, Jean means surgical masks. Jean goes on to the percentage of inward leaking for K95s and surgical masks and N95s. So basically, what do you recommend as far as masking goes?
Get what you have available to you. The biggest and most important thing is certainly the fit around the nose, under the chin, and around the cheeks. So if you can get a very good fitting mask for that reason, in that way, you're going to be good. So certainly we know that the N95 masks filter particles better than the surgical masks and better than the 2 to 3 layer cloth mask. But the recommendation is to make sure that fit is good no matter what mask that you have available to you.
Melissa has a question about vaccines. She would like to know which vaccine works best for infants, Pfizer or Moderna. There are differences in how they're going to dose these vaccines based on which one you get, right?
Yeah, I think they are both going to be for the minimum age of 6 months. Again, haven't seen the full data set but we know that they are authorized, and so the data set does look good as far as protection. You know, they really talk a lot about protection from infection or symptomatic disease. Even more important is obviously protection from hospitalization. Really what we have seen, despite very small variations between Pfizer and Moderna, especially for adults, is that there is very little variability in those two. So either one is really going to be appropriate.
I have a super interesting question from Sharon. And Sharon, I'm so sorry you went through this. Sharon, this is for Dr. Patel. Sharon wants to know, she says she had a headache with an aura for several days, then it ended with a stroke. So Sharon would like to know if the headache caused the stroke or the stroke caused the headache. Dr. Patel, is there any way of knowing that?
Yeah, that's a good question. Now, as Dr. Ford mentioned, with migraine, with aura, there is small risk of stroke, but there is a possibility that this migraine and aura caused other like stresses, and stress can increase your blood pressure and can cause stroke. So the likelihood of getting stroke from migraine is really low. It also depends on other factors like diabetes, high blood pressure.
Lisa has a question, and this is for Dr. Ford. She would like to, man, you can tell how much this topic resonates.
It's huge.
They're just, I keep scrolling and scrolling, and so many people are affected by this,
Absolutely.
which is such a shame. Lisa wants to know if you can talk about vestibular migraines. What are those?
Yes, so vestibular migraines have gotten, I hate to say more popular, but have gotten more frequently diagnosed in recent years. And so vestibular migraines can be a normal migraine with dizziness, so it can be spinning, vertigo, or just feeling off balance, or it can actually be just the off balance feeling or more of a spinning sensation feeling. So it's usually going to have to be in someone who's had migraines before, most typically, and will have associated features like migraine with them. There are medications that help with that. There's even a new device that's being looked at. It's needing some more funding at this point, but it's a device that you put in your ear actually, and it gives little puffs of air and hopefully will help with dampening those responses. So a way to know that if you're at risk for that is if you're in the grocery store and you're walking down the aisle and it seems to trigger you to feel odd or off balance or feel nauseated or dizzy. That's one of the signs. When you're driving, if that does it. So it's a lot of movement in your peripheral, so the lateral vision of your eyes, where your eyes can't seem to process it as fast as the brain needs to. It's kind of a disconnect. And so that seems to be a big trigger for them as well.
When you talk about anything in the ear, you talk about puffs of air, it reminded me again of the migraine story I did. And the woman that I had talked about that was getting Botox in her head ultimately got part of her ear pierced, the daith.
Yes.
It's the like chunky part right here. And there are tons of people online who say it's helped. The verdict was still out with her. Have you had experience with people piercing this part and it helping?
Sure. So there's very limited actual scientific data on the piercing. So most of the data that's been, quote, published has been from
on
a
YouTube?
survey done on the chronicmigraine.com website. So it was a bunch of people who went ahead and, put their 2 cents in. What I will say is, if you're a person who loves piercings and you feel like it's something you want to take a risk and do, then I think it's fine to do that. I wouldn't do it just because of the migraines. Unfortunately, I have a lot of patients that have migraines. So I've seen some pretty nasty complications with that because it is in a poor place of vascularity and it is hard to heal there. So we've seen a lot of infections, large hematomas. So it's just something that you have to take those risks and benefits into account. But scientifically speaking, I think we have to wait until we have a little bit more of data that actually supports it to say I would recommend it.
Lestco has a question for Dr. Hawk. For vaccines for kids under the age of 5, do the doctors know how many children were used in determining the efficacy of the 3rd dose during the trial? Was this data from the Omicron wave?
Yeah, I think that's a really good question. I thought there were really only a few thousand children in the Moderna and Pfizer studies to look at clinical efficacy in the vaccines. That's what I remember off the top of my head. I'm sure we can get that number and data to support that, but I don't think it was the large tens of thousands, 40,000, 30,000 that were used in adults. I think it was a smaller, a few thousand for that. As far as was it Omicron, I'm not sure that there was much, if any, Omicron in it at that time. I know that they have been looking and examining the data for several months now. If it was, it would be a very small percentage of those children during the Omicron wave.
Sandra has another question for you, Dr. Hawkinson. Do you have any information on diabetes and youth post-COVID?
Well, we had our diabetes expert on the show, Dr. Robbins, and we know that certainly with adults, you can have an increased risk of diabetes per year after having COVID, even up to 40% in some studies. As far as children, don't understand and don't know the full data set on that, but we know that, again, adults or older children, adolescents, do have that risk of diabetes after COVID-19. Certainly, when you have probably more severe disease, having to go to the hospital, having to go to the ICU, you're going to have a higher risk. We know that your risk of complications overall is higher with that more severe disease. But as far as the pediatrics data, off the top of my head, I don't know for sure about that risk of diabetes, but we know it's there for adults.
One more question for both Dr. Ford and Dr. Patel. Dr. Ford, I'll start with you. This is from Angela. Angela says this, and I'm not sure how much either of you can speak to this, so you'll have to just let us know. Angela says, I have had electric-like flashes and an eye bleed last year. Can the wrong dose of high blood pressure meds cause this? Because after my meds were adjusted, it stopped. It sounds gruesome, an eye bleed. Dr. Patel, have you heard of anything like this?
No, I have not heard anything like that, okay. But usually if it stopped after her medication was stopped, then likelihood that was related to medication. I would ask also Dr. Ford what she would say about this.
Yeah, so I mean, it depends on what we're referring to, but definitely with hypertensive urgency or emergency, so if the blood pressure was too high, it definitely could cause a retinal hemorrhage or other hemorrhages within the eye itself. So if the blood pressure was high, absolutely that could cause it. Medications themselves causing retinal bleeds or hemorrhages or vitreous tears are actually pretty rare, so I think it's probably more related to the blood pressure itself, but again, not an expert in the eye itself, but I would say that's probably more likely.
Our viewers love asking questions of our doctors. I mean, when they see doctors answering questions in live time, they want to get all their questions in. Such an interesting topic today and fascinating to talk about this issue that impacts millions of people on the regular basis. I want to get some final thoughts from our guests. So I'll start with Dr. Patel.
So regarding Ramsay Hunt syndrome, I would say that we need to take vaccination. So if we never had chickenpox infection, then we should get this vaccination at any age. If we already had chickenpox infection, then we should get this vaccination at the age of 50. And we should not worry about any COVID infection or COVID vaccine leading to zoster activation or Ramsay Hunt syndrome. And if we have any symptoms like zoster infection, like painful rashes, then we need to go to doctor. And if we start treatment early, within 72 hours of symptoms onset, we really have a good chance for good prognosis.
Dr. Ford, what are your final thoughts as you got flooded with questions about migraines from so many people suffering?
Absolutely. So in terms of the migraines, if you're someone who has even headaches twice a week, that's not normal. So go talk to your doctor. There are lots of options for treatment. Taking over-the-counter meds like ibuprofen, Excedrin, and Tylenol are all fine to a point, but they all also have long-term significant impacts to your health as well. And so if you're having to do that more than once or twice a week, it's time to go see your primary care doctor or your neurologist and get put on other treatments. So my highest encouragement is just go seek out your doctor and see if there's some help they can provide.
Dr. Hawkinson, who's still on remote from Utah, I want to have your final thoughts on COVID. And also, I'd love to know if you have any advice for the thousands of us who are headed out to Boulevardia this weekend. It's going to be so hot for that event.
Yeah, going to do some hiking today. Going to make sure I hydrate. I think that's important. Hydration and sunscreen is going to be extremely important, whether you're hiking in the desert or you're hiking and doing things at Boulevardia.
Through the beer
Especially vendors. If you're drinking beer, make sure to drink a lot of water as well. So I think it's going to be all about hydration and staying in from the sun. Also, just did see that Moderna had about 6,700 pediatrics, 6 months to about 6 years in their studies for that. Don't know what Pfizer was, but again, it's not as high as with the adult studies. And overall, I think this is a great show. We also know that COVID, for one or more reasons, causes headache, whether it's COVID weariness syndrome or headache during the acute illness. And just to want to appreciate our guests and thank you for their insights. And just overall, people, when you are out this weekend, please continue to hydrate, wear your sunscreen, stay in or under the shade as much as possible, and just be safe.
Thank you so much, and thank you all for being with us today. Thank you to our doctors for making time out of their busy schedules to join us. Remember, you can watch our shows anytime. Just log on to Facebook, YouTube, or Twitter. And as we leave you at the start of this Father's Day weekend, we would love to share some photos of all of our dads here on the Morning Medical Update. And also, we want to celebrate our teammates who are dads themselves. Thank you to the great dads out there. We hope you have a fabulous few days ahead. Do whatever makes you happiest. Have a great weekend.
New research finds children are not protected against Omicron if they previously had COVID. The news comes as children under 5 could soon start getting the vaccine. Monday at 8, the new impact COVID is having on both kids and adults.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcasts. Now, everywhere podcasts are available.